Okay, so today we're going to be talking about wound care. We don't have the supplies on hand to simulate it, so we're just going to talk about it. The basic thing is you're going to remove the old bandage and you're going to apply a new one. When you remove the old bandage, you're going to assess the wound, and as soon as you remove the bandage, it becomes a sterile process after that. So you will remove the old bandage with clean gloves and assess your wound, and then depending on the type of bandage that it was, being a wet to dry, dry to dry, wet to wet, you're going to reapply whatever bandage is in your orders to reapply. So if it's a wet to dry, it's going to be a wet dressing that you allow to dry, so that it'll remove dead tissue and drainage from your wound. If it's a dry to dry, it's just going to be a basic change. Those are going to be for like pretty much surface wounds like skin tears and stuff. And then a wet to wet is going to be for a wound that tunnels under the skin. It's going to help to allow the wound to heal from the inside out, so that you don't have just a pocket underneath your skin that cuts itself off from everything else. So for pressure ulcers, you're going to obviously try to prevent those by rolling your patient every 2 hours. Depending on the stage, will depend on the dressing that you use. If it's just stage 1, it's just going to be the basic, what would be classified as dry to dry, where it just kind of covers it and pads it, and then the deeper it gets, we'll have to use a wet to dry dressing to allow that to heal. We do have a couple of drains that we have talked about. I don't think we have them on hand, but I think that was the Jackson Pratt drain was one of them, and I do not remember the other one. We also have the wound vacs that seal around the wound and just constantly pull the drainage off. That's all I have for wound care today.